Good day, everyone. Welcome to another episode of Collaborative Connections, a space for sharing and learning, sponsored by the Society for Oncology Massage and the Society for Oncology Aesthetics. My name is Ericka Clinton, and I will be your host for this episode. On today's podcast, we have Eleanor Oyston. Eleanor has been a massage therapist in Australia for 26 years and an educator who founded S4OM, recognized education provider organization Oncology Massage Global in 2017. Eleanor has been in the medical field for over 30 years, is an international educator and a developer of in-hospital oncology massage programs in both Spain and Argentina. Welcome, Eleanor, and thank you so much for taking the time to join us today.
Hi, Ericka. It's a privilege.
Such a pleasure to have you on. You're in Australia. We're here in the US. So I thank you for giving us some time. What time is it there for you, by the way?
It's 8:30 in the morning.
Okay. All right. Wonderful. I would not be as perky, probably not having had coffee yet. So again, I thank you for joining us at such an early hour.
I'm an early bird. That's fine.
Well, I'd love to start off by having our folks learn a little bit about you. So why did you decide to focus your work as a massage therapist in oncology?
I think it started because I'm actually a diagnostic cytologist, and I looked down the microscope diagnosing cancer for about 30 years before I became a massage therapist. So I left school and I went into pathology laboratories. And when I had my children, I specialised in diagnostic cytology. So that's looking at sputums and pap smears and fine needle biopsies and things like that. So I have an intimate knowledge of what every cell in the body looks like, whether it's healthy or not. And I came to massage with that kind of background. And when I first started massaging, I was told I wasn't allowed to touch people that were sick. And that was contrary to everything I knew about cells and all the wonderful chemicals that we create when we relax and we actually feel the benefits of our feel-good cells like endorphins in our body, feel-good chemicals. So I was drawn to work at a place called the Quest for Life Foundation, which was with a woman called Patricia King, who ran retreats for people who had cancer or were in cancer treatment, and their partners or their carers. So that was my first experience of working with tactile therapies with people with serious illnesses. And Patricia was a wonderful mentor. And then I read about Gail's work because I was searching for somebody that thought how I did about touching people with illnesses, and I found that she was amazing. Gail, I met her at a conference, Society for Integrative Oncology conference in New York, my first ever trip to New York, which was so exciting. And there was Gail on the panel, and when the questions came up, everybody looked down the panel and said, "What do you think, Gail?" And I thought, I think she's the one I need to come to Australia and give us some teaching. And after the workshop, I went up to her and said, "Do you want to come to Australia?" And she said, yes. So I came home and I got some funding from the Cancer Council of Australia, and that was enough to bring Gail out to Australia for a whole month. And she taught 48 students in the month. She said she'd never been worked so hard in her life. So I dragged her up and down the east coast of Australia, giving lectures and talks and teaching classes. And she left me with a little cohort of inspired women. There weren't any men at that stage, inspired women. And all I had to do was take it forward from there and write some courses and get them accredited with S4OM, because I really believed in the principles of S4OM, which is to create an international standard that people can go anywhere in the world and know that if they have an oncology massage therapist that is accredited by S4OM, they're going to get treated properly and they will cause no harm.
That's wonderful.
That's sort of how I got started.
That's so wonderful. And it's such an amazing arc. It's like your life was totally established in the scientific world. Yeah. And then it moved into what I consider kind of a science and an art, which is massage. Yeah. And just to get, the best of both worlds. And then to have Gail in your life. I mean, we are all more blessed because Gail McDonald is in our lives and teaching many of us.
Yeah.
So
we both like beer, so that was good.
I didn't know that about Gail.
That was a bonus.
There you go.
Well, Australia has wonderful beer.
Wow. Good to know. Good to know. Great reason to visit as well. Yeah. So let's talk a little bit about your organization, Oncology Massage Global. What is the focus of this organization that you founded 7 years ago?
Mm-hmm. Yep. Well, I founded Oncology Massage Training in 2000, not long after I'd finished massage school, and developed that. And I worked with that and developed quite a large organisation. And believe it or not, age does creep up on you. And the world changes a lot and a lot of things change, like computers and things like that. So I realised that I needed to pass that on to the amazing people that I'd drawn around me as teachers and administrators. So that became Oncology Massage Limited, which is a registered charity, in 2013. And then by 2017, I decided I'd take a break, and the organisation was going well. And I also had a teacher who was Spanish speaking, and she had her own story of losing her mother as a young woman to cancer. And she was passionate about taking oncology massage to Spain. And I was sort of at a bit of a loose end, having stepped back from the organisation that I had established prior to this. And I said, take me to Spain and show me what it's like. So we went to Spain for a month, I think, 3 weeks. And we travelled around and met massage schools and went to mainly in Barcelona, but we found the best schools that we could, with the best reputation, and we went and met them and had discussions about us running courses there, and they said, please come. They offered me a spot to speak at an international expo. That was scary. And there was 23,000 people passed through the expo in 3 days. It was a complementary therapies expo, and I'd never come across anything like that in Australia. So I was very inspired, and they gave me speaking spots, an hour long, to talk about oncology massage, and I ended up teaching 53 students in a one-day workshop, just giving them the bones of it through an interpreter, through my colleague who interpreted for me. So that was like the gates opened, Ericka. It was just like so heartwarming, because they actually have a culture of touch. They're very affectionate, the Spanish people. And so it just seemed logical for them that oncology massage was good. So I came home and we rewrote the program in Spanish, and we got it accredited by S4OM, and then we took it to Spain and started teaching. And I actually only taught one course there. The rest were taught by 2 of my teachers, one Spanish speaking and one not Spanish speaking. But it was the teacher that had established Oncology Massage in the Olivia Newton-John Cancer and Wellness Centre in Melbourne. So she had tremendous hospital experience, and that's what they needed. They needed insights into things like that. So they went several times and over 3 or 4 years, and they identified 2 teachers over there, and they established a training program in a massage school in Barcelona. And it was just it just fell into our laps, literally fell into our lap. And we just went with whatever came our way. So, and then out of that, a woman or a man rang me from Argentina, and he said, we have a woman here that's teaching oncology massage, but she's left out all the contraindications.
Oh, dear.
And I went, well, people take your work and they run with it, especially if you're a confident Latin American. So he said, can you please come and teach here so that we get a more reputable course? And my Spanish-speaking teacher agreed. So we organised going to Argentina. So we had all our tickets booked, and then COVID struck in 2000, and we couldn't go. We took the loss on the chin of not going, and we had 3 full courses there waiting for us to arrive in Buenos Aires. So, and that was almost, they came to me, they found me, and because we had a Spanish-speaking program. So Oncology Massage Global sort of had to be a structure for what was happening in the Spanish-speaking countries. And so I had to give it a structure, and I had to make it accredited by S4OM, because I wanted people to link into that process, and they have. The guy in Argentina apparently is a member of S4OM, and he's come back to me just recently saying, I'm doing all these wonderful things, and can you tell me how you are? So we're still in touch. But it's really important to be aware of cultural norms in other countries, because we take so much for granted in our own country that we understand. That when I first taught in Germany, which was probably about 10 years ago now, I did some teaching for the International School of Bowen Therapy. They wanted oncology massage training for Bowen therapists, and I developed a weekend program for them. And I went to Germany to teach, and I said to the students, okay, whoever's getting on the table, get their gear off, and get ready for the demonstration, working on it, practicing on each other. And when I turned around, every student on the table had absolutely nothing on, nothing, not a thing, not a skerrick of clothing. And in Australia, you could say that, and people would leave their underwear on. They would not go down to absolutely nothing. But in Germany, nudity was fine, And I even went skinny dipping one day when I was in Berlin on that trip, on one of my days off, because I didn't have a swimming costume. So my friend who was looking after me there said, oh, nobody wears swimming costumes, just jump in the water and have a swim. And look, the differences in Germany and Barcelona, and it was exciting. And if you could step back from your own prejudices and your own belief systems and allow things to unfold, it was a privilege to guide people into being able to work compassionately with people that were really sick.
That's amazing. And I guess that's kind of the whole focus for you, is that aspect of working with people with, as you call, complex medical issues, and doing that compassionately, carefully, and with intention, right? Which is so much, and why touch is so powerful. But that's amazing.
There's always some part of the body that you can touch. Sometimes I've just held feet, not even rubbed them. I've just held them because that's the connection with another human being, that you're actually touching the untouchable. People feel like they're untouchable when they're dying, or they're extremely sick, or they're in the middle of chemotherapy or radiation. They feel untouchable. And just to be touched has a profound effect. Hold a hand, stroke a leg, it all makes a big difference. Yeah.
Huge difference. Why did you feel that becoming a recognized education provider with S4OM was so important for your organization?
Yeah, well, as I think I alluded to it before, I think what we need to have the medical world needs to know what we do behind closed doors, and the only way to do that is with research. So research capacity building within our industry is really important. We need to get behind organisations that are looking at our techniques and compassion, ambiance that we create that makes people feel safe and comfortable. We need to look at the research of mindfulness. You can't do an oncology massage without being mindful. But we don't record any of the things. We've all worked with people that are really sick, and you notice a variation in their body temperature. They'll have a cold patch or a warm patch, or not a hot bit. I used to think, am I ever going to be able to recognize a deep vein thrombosis? I'm sure I'll miss that. I knew all about how important it was. But, when you find one, it's so hot, that's not the right warm. That's not what you felt before. And your hands develop an intelligence that you can't get from a textbook, that you can only get from the experiences of being mindfully connected with somebody else. And that sorry, I've digressed. I'm not really answering the question.
But you're answering a better question. I think you're answering a better question.
Yeah, but no one is untouchable. No one. We cannot have modern day lepers. We cannot say to someone, you are untouchable. And I remember I was at the Olivia Newton-John Hospital in Melbourne and talking to the haematologist about whether my students were allowed to massage his patients. And we were sitting in a little cramped tea room surrounded by all his messy paperwork. And he said, well, show me what you do. So I just held his shoulder and did some gentle fascial release around his shoulder. And he went, oh, goodness me, that'd be wonderful. Yeah, you can do that to any of my patients. But on the other side of the room, the RN, the nurse unit manager, was saying, oh, how many platelets can they have before they can't have massage? Like, if their platelets are too low, don't let these massage therapists near them. Well, if you're a well-trained S4OM standard oncology massage therapist, then you will do no harm to the patient with no platelets.
Right.
So it doesn't. What makes sense is having a really high standard, having the bottom line is very high. And you need to keep the therapists that work in this field very safe and confident and safe for themselves, because I haven't met one massage therapist in thousands that I've worked with that has had anything other than the welfare of their client at heart. They want to, it's the same as doctors and nurses. We all want to keep the people that we're caring for safe. And in that process, you need to keep the massage therapist safe. That's as important, is that they are confident that they know what to do.
Yes. And how to make good decisions. Right.
Yeah. And along the way, I've been doing a massage and said, oops, we're stopping now and I'm taking you right down to the hospital because, this is happening. You've got a deep vein thrombosis in your leg and I can't work with you, but you need to see a doctor. And it's about that level of confidence. And the little local hospital, which was near where I used to work on the retreat programs, if we rang and said we need an ambulance, we had one instantly. And they'd take us with them in the ambulance with the patient, to make sure they got all the history from us of what we found out. And there was a mutual respect. And that respect came from common sense and reason and understanding all the things that we learn in the courses that are accredited by S4OM.
Wonderful. So you were talking about research a little bit, and that just sparked a question that I had in terms of, have you done research in massage? Are you thinking about doing any research in massage?
Yeah, well, I'm very fortunate at the moment. I have a fellowship with the University of Technology in Sydney, which is 3 years, but it's become 5 because of COVID, with an international group that are it's an international leaders in complementary medicine group, and it's distinguished Professor John Adams has developed this program to increase the possibility of writing more papers in complementary medicine. And we've just finished a paper on mindfulness. Is mindfulness taught in massage schools in Australia? And the answer is no. So we have to teach and we have to define mindfulness so that it's uniformly taught in massage schools. And we're looking. Well, the research paper that I got involved with 3 years ago, but it's finally in print, is the demographics of people who go into massage and Bowen therapy and what kind of people do this work, how old they are, how long they stay. And it's looking at career paths in the industries. So we don't at the moment have a career path for young therapists that are coming in. And in Australia, the burnout rate is about 3.5 years. People only stay in massage for about 3.5 years because they can't earn enough. It's mainly women. They go on to physiotherapy or naturopathy. We're not necessarily lost from the complementary therapy industry, but they don't stay in massage, and they certainly don't stay in oncology massage or palliative care massage. The average is about 3 years. So it's emotionally extremely taxing profession. And physically, if you're doing sports massage, it's deep. Your hands and your arms can't cope. And look, I was really lucky. I found massage when I was 50. I'd had a life, I'd had a career, and I had a pension. Like it was. I was able to fund myself to follow my passion. And oncology massage therapists don't often have that benefit of that security. So, yeah, I think we as an industry need to do research that looks at where to now, how we've established ourselves. We run fabulous massage schools. We've got a lot of community interest. The public knows what we can do, and they turn up on our doorsteps, and we have to lift the bar. We have to bridge the gap between people and their doctor. In Germany, they have people called Heilpraktikers, And you go to the naturopath, which is like a naturopath, and they sort out your diet, your exercise, your supplements. They do all that. And if you don't get better, they refer you to a doctor. Right. So you look as a public health issue, you get this first step is public health, to exercise, to eat well, to be happy in your job, to, have a peace of mind so that you can relax. All of those things get looked at. But if then you're still sick, there's pathology there. And that needs to go to pharmaceuticals, and it needs to go to surgery, and they have like a stream of caring for people. And we fit perfectly into that. We fit perfectly. And because we see it all the time, we see in our clients, we see what we're treating is the bad back or the sciatica or the frozen shoulder or the headaches, but they're all consequences of social and psychological trauma in people's lives. So people don't have to be diagnosed with a life-changing illness to come for massage. They need to have massage as part of their life. And I think that with good research, that can happen. And Gail introduced me to some massage that was done in Scotland. It was a scoping study in Scotland where they looked at all the cancer services that they had across Scotland, and people and asked them what people wanted from in their cancer services. And there was so many people said they wanted massage. The Iris Foundation, which is like our Cancer Council here, the Iris Foundation pays for every massage therapist in Scotland that wants to do oncology massage. They pay for their oncology massage training. And as a charity, that's what they do. And that came out of research. So I brought that research back to Australia and went to the University of New South Wales and said, can we do a scoping study? Because we have similar demographics to Scotland. We have vast areas of wilderness and we have coastal population. So, and we've got more people than Scotland, but believe it or not, but, it's the same demographic. And we did a scoping study. 93% of cancer services complied with that research. It's unheard of compliance in research. 93%, and 70% of people in that research, the first thing they want from complementary therapies is massage.
That's amazing.
So I thought every oncology massage in Australia would be run off their feet. There'd be so many people saying, we're going to do you know what? Nothing happened. Because it's not about the research, it's about who reads it, who reads the research, who pays attention, but more importantly, who funds it. Like in Scotland, the Iris Foundation said, this is great research, I'm going to fund that. And they funded training for massage therapists. And in Australia, nothing changed, except we had a big bill because we wanted to put money into the research, so we crowdfunded. But, and even investing as much money as our little organisation could, it was a drop in the ocean compared to what was needed to do that research on a national scale in Australia. So, research is amazing. It changes all the time. Double-blind research studies were the gold standard, for the last 50 years. That's been the gold standard. Not anymore. A lot of attention is paid to anecdotal research, observational research. They want to know. And look, we've got a guy who's our Australian of the Year at the moment, actually. He's a cancer surgeon who got his own brain tumour. And it was a really bad brain tumour, it was a glioblastoma. And he was working with skin cancer, melanoma, which we have a predominance of in Australia. And and they were getting great successes with melanoma, but they hadn't done the research on the brain tumor cells. But he said, pick me. I want to be the guinea pig. I want to try that. And what they're publicly telling us now is that they've just jumped over probably 10 years of research that would have been the slow progress had they done it by the traditional methods of research. Whereas now they've got all this information from one patient. So, whether that will affect how they do anything, but he's an Australian of the Year. Like, he's a pretty important person at the moment.
That's amazing. And he may have saved his own life.
He may have saved his own life. He's certainly doing very well. But that, I think we've got where research was always sort of research. Science was always a bit frightening because we always thought of research or science as what we learnt in high school. But what we learnt in high school was 50 years ago. What happens now in the research world is completely different. It's very dynamic and it's very exciting. And we can do it. Now, massage therapists can gather information around what happens behind closed doors. And that's our responsibility, is to let the world know what we do. And we've discovered that there are about 8 tools for looking at what happens behind closed doors. One of them is as simple as pain scale.
Mm-hmm.
What's your pain scale before the massage and after the massage? Have you gone from 8 out of 10 down to 3 out of 10 at the end of the massage? Well, people will tell you that. That's a simple question, and you're not asking them to tell you whether they liked your work or not. You're actually you're giving them something subjective to talk about. So, and there's a lot of those tools out there that we can have a choice of using, and we can decide which one works best for our clinical practice. Because, when we're not, what I've learned over the years, when we're not working, we're not earning any money. When we haven't got our hands on someone, a therapist isn't earning any money. So I've done more public speaking than you can poke a stick at in Australia, raising the flag for oncology massage. And I've often been the only one in the room or round the boardroom table who isn't being paid a salary by a university or a foundation or an organisation of some sort. I'm there because I bought the plane ticket. I'm there because I'm paying my hotel room. I'm there because I'm passionate about oncology massage. Now, I don't think the industry owes me for that. I just think we as an industry need to acknowledge that we aren't doing a lot to promote ourselves because we're not funding or backing the people that are prepared to go out on the limb and say and speak about the work, like you are now. I mean, I imagine this is a voluntary job for you with S4ON. I'm sure they're not lining your pockets with silver. So, we need to let the world know that we're not for free. We really are giving a tremendous service back to the community, and that needs to be recognised. We need to start funding this kind of, or finding a way to fund it. Find a benefactor, like they did in Scotland. They found a benefactor that in an organisation called the Iris Foundation, bless their heart. But, we have got a lot of potential to create a more visible industry, because we're often humble. Therapists are often very humble. And if someone compliments them on their work, thank you, that's your body doing it, or, you're actually taking really good care of yourself, instead of saying, yeah, massage makes a really big difference. I'm really glad you're feeling the benefits. We don't say that.
Right. Right.
As an industry, we're busy being, very humble. So, I think we've got to grow up into the 21st century and put ourselves into the appropriate place. There's a place for everybody. There's a place for the medical specialists, which are, they're amazing people. They have amazingly dedicated lives. They work horrendous hours. They often have terrible family situations because they're never home, and there's all this giving that goes on that we're aware of from the medical profession. But that's equally balanced from the complementary medicine profession, because we're all caring about people and their discomfort or their lack of compassion, whatever it is, we're aware of it. A lot of things that lots of people aren't aware of. And I am rambling now.
But
we can have Ashley take me out if she needs to.
No, I think this is wonderful, and this is so inspiring. I have to say, I mean, you put so eloquently, I think, so much of the struggle that we all have, no matter where you're practicing, is that we may not give our work enough credit. Therefore, we don't give ourselves enough credit. And in that way, we sometimes diminish our greatness. And yeah, and that can be its own major challenge and problem and impediment to more funding, more success, more access, right? Because when it comes down to it, those benefactors really pay for access for people to have therapeutic touch, which is so important. And I think we need to be the defenders of that for ourselves, our success, our longevity, but also for us to be able to do the thing that we went to school to do, which is to help people. It sounds so simple, but it really is the way. So I'm going to ask you one last question. Being that you are an international partner, truly in Australia and Spain and Argentina, where your programs exist, what would you like to see S4OM do on an international level in the next few years?
Well, I think we've had a bit of trouble getting the Spanish teachers registered with S4OM because of the language barrier. And just this week, my Spanish teacher, who's no longer teaching, actually, she's burnt out, and we all were after all that. But what she said is that she will become the go-between between S4OM and Spanish-speaking people, so that they can fill out the forms and they can get registered. And because especially the two teachers in Spain, they've been teaching massage in the most reputable of massage schools for 15 years. I mean, they know what they're doing, and they just absolutely excelled in our program. They're brilliant young women, and it's really important that they get registered with S4OM and they can work towards developing their own course, and they will own it in their own country. So it's about just bridging the gap, which is a language barrier. And the people in Spain have found their way into being registered as preferred providers with S4OM, but they need to develop their course as well. And we can help them with content, but the language barrier for S4OM is still going to be there. So we've now got Monica Moreno, who's my Spanish teacher, has said just this week, please, I will be the go-between between the Spanish-speaking people and S4OM so that we can get them registered, because we need global conformity. We need the gold standard. We need that trust that the medical world will have if we stand together.
Yes, absolutely. So please, you have my email, have her reach out to me so that we can start this conversation and make sure that we get this done.
Yeah, fantastic.
All right.
Thank you for your work. It's brilliant. I love it.
Thank you, Eleanor, so very much. This has been amazing. I so appreciate everything you shared. I know that people will really appreciate the time that you gave, but also the things that you said, which, as I said before, were tremendously inspiring. So I thank you. Thank you. Yeah. And we're going to end, collaborators. So have a great day. And I hope you enjoyed today's podcast.
Thank you for listening to S4OM's Collaborative Connections podcast. If you found the information we shared today insightful and valuable, share this episode with a friend, or let us know you love this episode by tagging us on social media. Our goal is to bring the oncology massage community the latest research, education, and best practices possible. We love hearing from our listeners and welcome your thoughts and suggestions for future episodes. If you have any questions or feedback, you can email us at podcast@s4om.org. Until next time, thank you for listening.